Hello, I'm Dr. Dennis McKenna, joined again by Dr. Fred Venditti, our Hospital System General Director. Update from Albany Med on the situation related to COVID-19. Talking to county health officials this morning, we can report that in Albany County there are 42 confirmed cases of COVID-19. We obviously have increased the testing over the last couple of days, so we're seeing that number go up. What that's translating to inside the hospital is we currently have 7 patients here at Albany Medical Center that are admitted and being treated for COVID-19. We have 22 other patients that we're currently investigating. Of those 7, 4 patients are on the floor, 3 patients are in the ICU. I want to credit our pharmacists and our critical care doctors who are currently using the most cutting-edge therapy for these patients. We're optimistic and we're seeing great recovery. We'll continue to monitor that as we go forward. We have an adequate number of ICU beds and ventilators and floor beds for the foreseeable future. In addition to that, our testing tent remains open. Between the drive-through, the testing tent, and inpatient, yesterday we tested 650 people for COVID-19. I should point out that there is a limitation on the number of testing kits available. Over the next couple days, after having spoken to public health officials, we will need to reduce the amount of testing we're doing in the outpatient setting. We're going to shift that focus to those that are most needed on the inpatient setting and healthcare workers. We will still keep our testing tent open for evaluations. We're going to switch from testing to evaluation, and we'll talk more about that in the next couple days.
Let me just add, Dennis, that when it comes to personal protective equipment, masks, gowns, etc., we have plenty of supply. The supply folks, the buyers, have done a tremendous job finding new sources for us, and they're bringing supplies in on a daily basis. So we're good there, too.
Great, great. Any questions?
So there have been some questions. Actually, we haven't talked much about the practice. So here's a question for the practice. What are we doing in the practice to provide safe care for our patients?
It's important, obviously, that we continue to provide care not only in the hospital, but our dozens of outpatient practice sites. We know that people want to be able to access our specialists. So we're piloting this in pediatrics and psychiatry and a surgical specialty tomorrow. And by next week, we'll allow virtual visits for all of our practice locations. That will allow patients who meet the criteria of being established or needing a medication refill or don't need an in-person exam to do an examination over the phone with the provider. They'll be scheduled and we'll give that opportunity. If you do need to come into the clinic, we'll still offer that as well. We'll screen those patients before they get here. So we think this is an opportunity for people to still see our specialists, but to do it remotely. And so we're going to start that next week.
That's great. The remote care that you're talking about is going to be something that we're going to be able to carry forward even after this whole crisis.
That's right.
That's great.
So yesterday we talked about work from home. Some people wanted some clarification on the process.
So the process goes like this. If you're an employee here at the medical center that you think you could work from home, talk to your manager. Your manager will then go to the Workforce from Home Committee that has HR folks, IT folks, etc., who can really assess all of the elements that need to be in place for you to be able to do that. They'll convey that back to your manager, who will convey that back to you. So that's the process.
So it starts with the employee approaching their manager. Okay,
absolutely.
Great. And we've heard a lot in the media and in various areas about elective surgery. I know we've talked about this the last couple of days. Can you talk again more about that?
Yeah, absolutely, Dennis. So as I said yesterday, we have a meeting every day at 11:30 where a large group of us get together to talk about this. And today we made 2 decisions. So first of all, after assessing all of our capacity, beds, ICU, staff, etc., we've decided to go ahead with cases tomorrow. Now we have 37 cases scheduled tomorrow, so kind of a light day, but we are fully prepared to provide that care. We also spent a lot of time talking about what we should do going forward, and we made a decision to align with the American College of Surgeons and CMS on their recommendations on essential and non-essential cases.
So what's a non-essential case?
Well, let me give you an example. That's probably the easiest way to explain. So if you have a patient who's going to have a hernia repair, you might consider that non-essential. We do them electively. And in most cases, that's probably true. But if the patient is in a great deal of pain, if it's very large, there might be clinical reasons why it's really essential to operate on that patient. So what we intend to do is have service chiefs come up with categories, essential, non-essential, and then have the surgeons work with their patients around making a decision, should they go forward or not.
Okay.
That's where this decision needs to rest.
So aligning with CMS, and for truly non-essential cases, pushing them out.
Pushing them off. And pushing them off, we need to think about this. This is going to be months that we're talking about pushing them off, so that has to be factored into the decision as well.
All right, I'm sure we'll continue to talk about this.
We will absolutely talk about this.
Okay, very good. Well, that's our update for today. We thank all of you for everything you're doing. We ask that you take care of yourself, you take care of each other, and we'll see you tomorrow.